Hello, everybody. My name is Dr. Vera Tarman, and I am an addiction physician working out of Toronto, Canada. So welcome, and I hope you find something useful. Okay, so I've talked about willpower, and now let's get back to talking a little bit more about this nucleus accumbens and amygdala. And remember when I talked about the definition of addiction, again, this is in the context of giving the larger picture. So remember I gave the definition of the dopamine, which is going to that nucleus accumbens, that NAC button there, and is this is like the backstory behind the nucleus accumbens. Is that there's this flood of this firing up of dopamine that manifests as a feeling of craving or itch or urge or excitement or I'm just going to, like I was saying with the Tourette's, you have the desire. It's like you want to itch something. It's not actually the itch, it's that wanting to scratch. That is the dopamine. And so that's the nucleus accumbens. And with that definition of addiction, when that gets enhanced because of drug use or behavior, and so that now you're really wanting to itch, it's a super big itch. Essentially, it's an abnormal or supernatural or extraordinary desire. Then that's going to the nucleus accumbens, and then tolerance develops, and then eventually dependence develops. And the thing about dependence, like I guess when you think about where is that line from recreational or hazardous use into addictive use, it's probably when it goes from the euphoric or the intended consequence. An alcoholic will say, I don't drink for the taste, I drink for the effect. But they're not drinking for the depression and the devastation. They're drinking for the effect. And so there may not be an alcoholic at that point. They might still be a social drinker, recreational drinker, hazardous drinker. But what is that line? It's probably when it goes over from tolerance to dependence. I need that 600 to feel 200. 200 doesn't do it anymore. 400 doesn't do it anymore. 600 doesn't. And if I want to get that desired effect, I have to have 800. And if I don't have the 800 or the 600, I don't get the desired effect. But even if I don't get the 600 or the 400, then I'm not going to get the 200 because I need 400 to feel 200. And if I don't have 400, I don't have 200, I'm going to be minus. And so that's when dependence happens. When if I don't have it, I don't even care about the desired effect anymore. I'm not going to normal. I'm going to minus normal. Dependence is when you're in minus normal. And that's probably the line when it's like, okay, I'm not going to drink because I don't want the desired, I don't need the desired effect anymore. I don't need to get drunk tonight. It's fine. I'm going to stop. Good. That's not an alcoholic or a drug user, or an addict. But when they say, but if I don't have it, I won't be able to sleep or feel normal or be able to function in the world. I need this thing. I'm dependent on this thing to feel okay. Now we're talking addiction, especially when there's impairment and all the rest of that around it. So that's probably where that line is drawn. And in this larger picture, that's when the amygdala gets kicked in. You can see my finger there, sort of. So it's not, the desired effect is the nucleus accumbens, and that fear of withdrawal, fear of, I don't know how I can live without this substance. Fear, anxiety, impending doom, that's the amygdala. And then eventually addiction becomes negative reinforcement. I'm doing it just so I don't feel terrible. So it moves from positive reinforcement, desired effect, to negative reinforcement, just to feel normal. I don't really even want it anymore. I just want to feel normal. That's the negative reinforcement. And that's when the amygdala has kicked in. That's when we know we have addiction. So that's the story of dopamine. Now, what I want to do is start talking about some of the other neurochemicals, because if that's not complicated enough, everything that I've just said about dopamine, and now we actually want to look at some of the other neurochemicals, which complicate things even more.